Hello everyone, my name is Nathan Green, and today I'm going to do a presentation on attention deficit hyperactivity disorder, as well as behavior therapies. Let's begin. What is attention deficit hyperactivity disorder? Attention deficit hyperactivity disorder, otherwise known as ADHD, is a neurodevelopmental disorder that causes a person to have trouble maintaining their attention during any task, as well as to be unable to participate in a quiet manner during any form of activity for a prolonged period of time. To be able to be diagnosed by a professional, symptoms have to be detected prior to reaching 12 years of age and must occur in a multitude of settings. Now, this doesn't mean that it can only be an isolated incident. This means that these symptoms occur everywhere, like in every situation. ADHD is one of the most common psychological disorders that affects children within the United States. The group most likely to have ADHD are those who were assigned a male at birth. Worldwide, ADHD occurs in around 5% of children, and that's like in all cultures, so it may seem small, but that is it's relatively small, I guess, but still a good amount of people. Let's move on. Next, we have the causes. There are a myriad of potential causes and risk factors associated with ADHD. These include being prematurely born, being born with a low birth weight, exposure to alcohol and smoking during pregnancy, exposure to lead during childhood. Now, this aspect is worsened by outside factors such as poverty, so keep that in mind. Continuing forward, we have the use of pesticides in combination with genetic risks, exposure to harmful events at a young age, such as being physically, sexually, or verbally abused, and genetic differences, which may make a person more prone to developing ADHD. Recently, studies have found that sensory and neurological problems are strong predictors of ADHD symptoms in 17-year-old individuals. Next, we got common symptoms of ADHD. ADHD is comprised of three major symptoms: inattention, hyperactivity, and impulsivity. Inattention is when an individual consistently abandons anything they are doing and is unable to remain engaged with any activity, and has trouble with staying focused in any capacity. Hyperactivity is when an individual is extremely active in an over-the-top manner, especially during times when this behavior is uncalled for. So this could be like during class, they're acting out in class and uncontrollably. So keep that in mind. It's not just like normal children not being able to kind of sit still. This is a very different, very uncontrollable type of behavior. Signs of hyperactivity include uncontrolled fidgeting and restlessness. Finally, impulsivity is when an individual engages in actions without planning or thinking ahead. This is usually done in situations where someone, such as a child, is unable to stop themselves from doing something that gives them a sense of gratification. Now, a recent study has found that adolescents with ADHD are more likely to engage in more impulsive and risky decision making than adolescents who do not have ADHD. The study also found that this behavior is tied to an aversion to delaying gratification. So a lot of this like uncontrollable behavior and inability to kind of control one's actions, a lot of it ties down to the inability to delay gratification. Like they feel like they need to do this, and it's uncontrollable. It's not like they're choosing to do this. It's just kind of how their brain is kind of wired. It's that they feel this need to get that instant sense of gratification instead of being able to delay it until further time. Moving forward, we have the negative effects associated with ADHD. ADHD has many negative effects associated with it. Among these are the fact that it can negatively affect children's ability to perform well in school, the fact that it can prevent individuals from developing socially, the fact that it negatively affects a person's ability to maintain good relationships with their peers, the fact that it increases a person's likelihood of being bullied in school, the fact that it increases the chances that a person may engage in illicit delinquent activities, the fact that it predicts that young adults will have lower quality relationships, the fact that it is associated with an increase in relationship issues, increased chances of imprisonment, and a poor socioeconomic status, and the fact that it increases the likelihood of developing depression as well as one's chances of sustaining injury. Now, that last part, the increasing one's chances of sustaining an injury, that's in terms of like, impulsive, unplanned actions, kind of just doing whatever comes to mind, that could lead to injury. Now, our final slide here is the treatment types associated with ADHD. The first type is stimulants, which includes drugs such as Ritalin and Adderall. These drugs work to increase dopamine flow within the brains of children suffering from ADHD. This increase in dopamine levels makes it so that these children are receiving the sense of pleasure that they would normally get from acting out, and thus allows them to be able to maintain more control over their impulses. Stimulants are typically the first treatment option used, as they are usually the most effective in treating ADHD symptoms. Following this is the use of non-medical interventions. These include physical exercise, sports training, and meditation. These activities give children with ADHD an outlet for focused activity, which allows them to build their engagement and focus skills. These interventions often work best when combined with the use of medication, which is why these, stimulants and non-medical interventions, these two things usually happen simultaneously. Now, finally, there's psychotherapy. This treatment, which is typically like your traditional talk therapy with a therapist, is the go-to route for treating young children, as well as those who do not react to medication. Interestingly, psychotherapy is also an effective way to treat ADHD symptoms in adults, as well as parents of children with ADHD, as it can help them de-stress and learn the best ways to deal with any difficulties that may come up. Alright, now we're going to move on to the behavior therapies section of this video. What are behavior therapies? Behavior therapies are therapeutic solutions that place an emphasis on more active strategies when working to instill change within a person's behavior or behaviors. They utilize learning in order to diminish or completely remove symptoms or poor behaviors that a person may exhibit. Behavior therapies demonstrate a departure from the psychodynamic and humanistic approaches to therapy, which are more focused on cultivating the awareness of why people have specific symptoms. Behavior therapies originally started with simple, classical, and operant conditioning strategies, but over time have branched out to include other methods, such as observational learning, cognitive factors, and self-instruction. Classical conditioning systematic desensitization. The first classical conditioning-based behavior therapy we are going to look at is systematic desensitization. Systematic desensitization is a behavior therapy that involves putting a person through a real or imagined situation that is supposed to evoke fear within them. This method is based on the idea of extinction, specifically extinguishing the fear response to certain fearful stimuli. It aims to get the client to remain relaxed when put in increasingly feared situations. This could be with things such as, in the picture showing, arachnophobia, or like the fear of spiders, starting out with small spiders and working up to bigger ones, and they may start with like a fake plastic spider and then move on to real spiders. Systematic desensitization has been proven to be an effective method for treating anxiety disorders as well as various phobias, to my point about the arachnophobia. Studies have also shown that when paired with music, systematic desensitization can be an effective technique in combating craving in drug users. I thought that was an interesting thing to point out. Next, we have the next classical conditioning-based therapy. The next classical conditioning-based behavior therapy we are going to talk about is aversive conditioning. Aversive conditioning, is a behavior therapy that is designed to eliminate problematic behaviors by decreasing the positive associations of an unconditioned stimuli. Specifically, this therapy solution pairs an unconditioned stimuli, such as alcohol, nicotine, or some other addictive substance, with a conditioned stimuli that would evoke a sense of aversion within the client. This conditioned stimuli could be anything, such as painful electric shocks, substances that induce nausea, or hurtful insults. Aversive conditioning has proven itself as an effective strategy for teaching people to avoid certain actions, such as addictive behaviors. So, like alcoholism or smoking addictions. As previously mentioned, aversive conditioning is typically used to counter addictions. Moving forward, we have our operant conditioning-based therapy. The operant conditioning-based behavior therapy that we will cover in this presentation is applied behavior analysis. Applied behavior analysis is a behavior therapy that aims to replace maladaptive behaviors with other, more positive and beneficial ones. This therapy technique is commonly used to treat those with autism spectrum disorder, or ASD, who may exhibit problematic behaviors, such as actions that can injure themselves. An example of this could be headbanging. When practiced early and for a prolonged amount of time, applied behavior analysis can improve the cognitive and language capabilities of young children with autism spectrum disorder. Now, this treatment type is extremely intensive, and because of this, has become controversial as it can create trauma for those who are forced to undergo the training. Just something to keep in mind. I think it's very sad that that people are coming away with this with a negative kind of experience, but it's understanding, and going forward, if we continue to use applied behavior analysis, we should look to do it in a more thoughtful way so that we're not traumatizing individuals or hurting them in some capacity. Finally, we have the effects of behavior therapy on ADHD. Behavior therapies can have a positive effect on ADHD symptoms. New studies are finding that behavior therapies, such as those developed for people with tics, are having significant effects on the reduction of ADHD symptoms over the course of many weeks. Now, this can be seen in this graph right here, specifically in the Vanderbilt ADHD severity graph right here. Over the course of 24 weeks, they used different behavior therapies to treat different disorders. So this included things like co-occurring ADHD, tic disorders, and psychosocial impairment. Now, if you look at this bottom left graph here, we see that the CBIT method, which is the dotted line, that is our kind of cognitive, I believe they refer to it as the comprehensive behavioral intervention. So that's one of our behavior therapy strategies, and as we see, there's a severe dip at around the 12-week mark in ADHD symptoms. So this does prove that over time, the use of behavior therapy can decrease the symptoms and severity of symptoms of ADHD. Now, this positive effect has started to point psychologists in a new direction in regards to developing new non-medical treatments for those with ADHD. A focus on behavior therapies could create a new route for ADHD treatments in the future. Now, as I mentioned with this graph, we see that it does start to rise over, I guess, the end of the study towards the 24-week mark. Now, this does raise the kind of idea in psychologists' mind that prolonged use of behavior therapies and sustained use could help with reducing over a long period, over the long term, could help in reducing ADHD symptoms and their severity. So, yeah, thank you. That's my presentation, and I hope you have a great day.